How do you tell a patient for the first time that they have glaucoma?
The first time I see a patient and I'm getting to know them, that you have to understand their perspective, or I try to understand their perspective. And the first thing that they're feeling is fear. They're in the waiting area, we depend so much on our vision, and they hear the word glaucoma or they're in a glaucoma practice being evaluated for possible glaucoma, and all that's going in their mind is I'm going blind, how am I going to take care of my family, I'm not going to see my child get married, and their mind's going everywhere. And so the first thing I do is I say, ma'am, you have glaucoma, but you're not going blind. And then I tell them, and you need to get that out right away, that when treated appropriately by an ophthalmologist, and sometimes one that specializes only in glaucoma, we win the vast majority of the time. And I let them know that. That's the first thing you need to get out, is they don't need to be scared of glaucoma. No one wants to have it, but when treated appropriately, nobody should go blind from glaucoma. And if you're being seen by an ophthalmologist that specializes in glaucoma or that knows how to treat glaucoma, you're going to be just fine. And that's the big thing they get out. And then I take a step back and let them digest that. And I then say, well, glaucoma is the #2 leading cause of blindness in the world. And the reason why it's so bad is we can't feel it, you don't know you have it, and by the time you notice it, it's too late. So the name of the game is prevention. And then I really just try to explain to them what glaucoma is. So it's when the pressure elevates and it damages the nerve that connects the eye to the brain, called the optic nerve. And it's caused by elevated pressure, and that damages the nerve. And anywhere in our body, once we lose nerve tissue, once it's gone, we can't get it back. So my goal is to prevent that. And once they understand that, it's really a matter of trying to give them hope and faith that if you stick with me, we're going to win. And I'm going to do my best to win. There may be some bumps in the road, there'll be some ups and downs, but in general, the vast majority of the time, we win.